The air quality of Delhi is toxic now. The AQI has reached 500. So we have with us Dr. Nangia. We'll discuss various aspects that how can we save our health when it comes to the air quality, and how can we take precaution to save ourselves if we are going out, if we are exposing ourselves outside. Sir, first of all, I would like to ask you that what are the impacts of bad air quality on the health of normal people, not only the people who are suffering with any kind of lung disease?
See, the impact of poor air quality can be very diverse. It could be starting with just simple cough, cold, breathlessness, watering from the eyes, nasal congestion, sore throat, to tightness in the chest. But then there can be sinister side effects also, which could include brain attacks, heart attacks. It also results in reduction in the overall lifespan. It can result in the development of various cancers. We're seeing a lot of young women coming these days who classically develop this, the smokers cancer, which we call it classically, which was called the smokers cancer. We're seeing that more in young women now, primarily because of exposure to the air pollution outside. Then the impact can even be when the child is still in a womb, even in an unborn child. They could have poor lung functions, poor development of the lungs, premature births. And of course, as the child grows up, they could develop respiratory allergies, asthmas, and other kind of infections as well.
So, what all you can we offer to the people? What all suggestion you can offer to the people as far as outdoor activities is concerned and the exposure is concerned?
See, basically, we need to decide our outdoor activity based on the outdoor AQI levels. If the AQI level is less than 100, then anybody and everybody can be moving out, doing their exercises outdoors, there's no issue. When it is between 100 and 200, then the high risk group usually includes people who have an underlying lung disease like asthma, COPD, interstitial lung disease, pulmonary fibrosis, lung cancer, or those who have diabetes, hypertension, strokes. They would classically fall into a high risk group along with people who are elders and then the young children. So this group, when the AQI level is between 100 to 200, should not be performing any strenuous physical activity outdoors. They could move out of the house though. When it is more than 200 to between 300, then any normal individual who has an underlying lung disease, who may not be having any underlying lung disease, yet should not be doing any kind of strenuous physical activity outdoors. They could go out but restrict their movement outdoors as much as possible. And people who are in the high risk should not be going out at all. And when it is more than 300, then nobody should be moving out without a reason. You have to have a solid reason to be moving out. Otherwise, unnecessarily movement outdoors can harm your lungs. And the question of exercising outdoors does not arise for anybody there. Exercising, when I say, also means morning walks, people who are running marathons, people who are going for their athletic trainings. So they should all not be moving out of the houses. For anybody to move out, they should wear a mask, and this should preferably be an N95 mask.
Sir, any precaution or instruction for the people who are COVID survivors, as the lung capacity decreases whenever a person suffers with COVID-19? So, any suggestions for them?
So basically, COVID survivors can be divided into two groups. One who have residual kind of a lung damage left, which may be permanent or still recovering, and the other group which does not have any kind of lung damage left. So the group which does not have any lung damage should consider themselves in the normal category, whereas those who have an underlying lung damage or who've got some residual damage left to the lungs, they should consider themselves in the high risk category and follow the precautions accordingly.
Sir, the COVID lesson, what we have learned from COVID, wearing mask and taking precautions, work from home, do you think this is the time where we need to take those kind of precaution when it comes to the air quality, or as the air quality is bad right now in Delhi?
Absolutely, I would agree with you. See, you have to understand that the impact of poor air quality does not come immediately sometimes. The effect may be because of a long-term exposure. So this is also a situation where we should probably exhibit some kind of a self-restraint and not move out. Maybe it is not possible for the government to be calling a lockdown every now and then, but I guess we should consider it for our own selves, our own health, that it is a kind of a lockdown outside and behave like that.
As Dr. Vivek said, that we have to behave in a way so that we can save ourselves when it comes to the air quality, and we can save ourselves from air pollution. With video journalist Manish Jha, Shrutika, Delhi, for India Today.